And April is IBS Awareness Month, a digestive disorder that affects millions. In fact, it's one of the most common reasons people visit the doctor. I had no idea. Dr. Brent Wallis, Dr. B, our friend from People's Health, joins us to discuss the symptoms of IBS and how to manage the condition. How you doing, Dr. B? How you been?
Hey, Tommy. I've been pretty good. How about you?
I've been well, thank you. Can you maybe start by explaining the digestive system?
Yeah, sure. I'll give you a crash course in anatomy. So the digestive system really starts at your mouth and goes all the way through to the other end. So each part of the digestive tract really plays an important role in breaking down your food and actually, converting that food into the energy that our bodies need. So it starts in the mouth where you chew and you break down the food into smaller pieces. And then it really moves into an area called the pharynx, which is the back part of your mouth or your throat. And that's where it passes into the esophagus. And the esophagus is a long tube that just runs down to your stomach. When the food gets down into the stomach, acid is added to it, and the food breaks down and really becomes a liquid. And then it passes from the stomach into your small intestine. That's where nutrients start to be absorbed and more breakdown occurs. And then the last part, it passes into your large intestine, and that's really where a lot of the water is reabsorbed from that liquid that's been produced, and then you eliminate the rest. So now you know everything about the digestive tract.
But it is an amazing thing if you think about it, the way our bodies work, isn't it?
Yeah, it really is amazing, straight through and gives you everything you need, all the nutrients that you need.
So what is IBS?
So IBS is irritable bowel syndrome, and it's very, very common. It's an intestinal disorder. Really affects probably about 25 to 45 million Americans. We don't know exactly how many because the diagnosis is a little bit difficult. It's a situation where the digestive tract really doesn't function properly. It doesn't do what it's supposed to do. And it may be because there's a signaling problem from the brain to the intestines. We don't know what the specific causes are, but we do know that it's a very long-term condition. It is somewhat difficult to treat, but there are some treatments. There's unfortunately no specific test to confirm IBS, so that's why you have to talk to your doctor about it.
What are some of the symptoms?
So the big things that we always look for, abdominal pain, stomach pain, usually relieved by going to the bathroom. People get a whole lot of bloating and gas. They can have a lot of cramping. And then there's really two different types. Some people have a lot of constipation associated with IBS. Some people actually have more diarrhea. So there's really two predominant different types. And those symptoms can really fluctuate from day to day, but they do happen very frequently. So this is not just something that you get from eating too much food at Jazz Fest. This is something that really can be a daily or a weekly problem for you.
It's a long-term thing.
Yeah, definitely. And people suffer with this for quite a long period of time before they actually seek any help for it. So that's why, again, if you have these symptoms, you want to talk to your doctor.
What are some of the triggers?
Yeah, so it's different for everybody. Certainly there are people that are triggered by certain types of food, and those triggers may differ from person to person. Some people have difficulty with dairy and cheeses. Some people, it may be certain types of vegetables they eat or even spicy foods. Certain drinks that you consume can actually cause problems. Anything with caffeine in it or excessive alcohol can cause problems. And then, interestingly, there are some associations with hormonal changes. So women who are on their menstrual cycle can actually have an increase in symptoms as well. And then, there are some medications that people take that can lead to IBS. But what's really fascinating is stress can actually trigger IBS. So feeling stressed out or having anxiety can actually lead to an exacerbation of the problem. So I usually tell people, if you're trying to figure out if this is something you may be suffering from, you want to start a journal to kind of log your symptoms and see what may be triggering you.
All right, let's take a break. When we come back, we'll talk about who's at risk for IBS and some of the treatment options that are available. Talking to Dr. B. Dr. Brent Wallis, our friend, Chief Medical Officer at People's Health, and we're talking about April being IBS Awareness Month and irritable bowel syndrome. 8:20, time for traffic now, WWL. Tommy Tucker, WWL, on his Thursday morning, April 28th, draft day. Our coverage begins at 4 o'clock here, and the guys will be on location with Draft Fest at Urban South Brewery on Chapatulas. And, yes, they will have the Pelicans game on, which tips off at 6:30. We're talking to Dr. Brent Wallis from People's Health about IBS, and we have already talked about symptoms and triggers. So, Dr. B, who is at risk for IBS?
Yeah, there are a few groups that we tend to see IBS a little more commonly. So it tends to start in your late 20s, but we definitely see it in all age groups. Family history definitely plays a role. So if you've got mom, dad, or a brother or sister who has IBS, then you're more likely to have it as well. And we diagnose it more commonly in women, but actually that may be because men are less likely to really seek help for it. And so the prevalence may actually be a little bit closer to equal. We see it in people who have migraine headaches, and also people who have something called fibromyalgia, which is a kind of a generalized pain disorder, pain all over the body. And in particular, like I mentioned, we do see it in people that have depression or who've had any kind of psychological trauma or have an anxiety disorder. The gut actually has a really extensive neural network, a lot of nerves running through it, and some people even consider it your second brain. And so that's why mental health can have a really strong effect on your digestive system in general.
So when you say you have a nervous stomach, you really do have a nervous stomach.
It really is, yeah. When you feel those butterflies, that's your brain communicating with your stomach.
So how do you treat it?
So unfortunately, there's no cure for IBS right now. So really the way we treat it is focused on lifestyle changing and really trying to reduce the symptoms and treat those symptoms that you have. So some of the things you can do, obviously, if you have food triggers, that cause IBS to flare up, you want to try to avoid those. I mentioned keeping a diary. You can keep a food diary to see if dairy may trigger you, or fried food or spicy foods. And if you find what that is, you want to avoid it. People do better if they eat smaller, more frequent meals rather than a really large meal during the day, because that bloating and gas can actually trigger a lot of the problems. Exercise actually has been shown to have a really great effect on IBS, so exercising regularly is good. And then that also helps you reduce stress as well. So, like I mentioned, since this can be linked to anxiety and depression, maybe talking to a therapist or talking to your primary care physician about what you can do to treat that stress can ultimately help. And, a lot of people ask me about probiotics, and does that help? And it may. Probiotics are good bacteria in your gut. There may be some benefits to probiotics, but that really hasn't been proven. So I tell people to always talk to your doctor before you start something like that. And then kind of the last is medications, and the medications are really geared towards treating, the cramping, the bloating, the diarrhea, or the constipation. And you always want to talk to your doctor before you start grabbing stuff off the shelf, over-the-counter medications, because they can actually interact with each other and with other things you're taking. And, the last thing I'll say, Tommy, is be a little careful, reading through the Internet. If there's a lot of good information on the Internet about IBS, there's a lot of good support groups, but there's also some information that may not be very accurate. So always talk to your doctor about those questions and what you may have seen.
How can people find out more about that 5-Star People's Health Plan, Doc?
Yeah, they can always come to our website at peopleshealth.com. We've got this and a lot of other information on there. And then we're definitely inviting people to come out and see us at our Medicare Center, which is on Veterans Boulevard. We're right next to Party City at Causeway. We take appointments, but walk-ins are welcome as well.
And you can call 800-978-9765, and you can follow People's Health on Facebook, Twitter, and Instagram. Thanks, Doc. You going to the Jazz Fest this weekend?
Yeah, I'll be out there tomorrow. Hopefully it's the last day of spring.
And don't forget the sunscreen.
Definitely.
I just love to give doctors advice on occasion. Thank you, sir. Have a good weekend.
Thanks, Tommy. You too.
You bet. Dr. Brent Wallis from People's Health.